The World Health Organization is describing the COVID-19 pandemic as not just a public health crisis, but one that will touch every sector and all must be involved in the fight. The nation's leader, Prime Minister, the Most Honorable Dr. Hubert Minnis, telling the congregation of the Church of God of Prophecy last night that the COVID-19 situation is a matter of grave concern. He said as Prime Minister, he has instructed the government and health officials to do everything in their power to combat, communicate, and respond to this health risk and crisis. Meanwhile, as part of the government's overall preparedness and response plan to COVID-19, a national co-coordination committee has been appointed. The committee is co-chaired by Chief Medical Officer Dr. Pearl McMillan and Executive Director of the Organization for Responsible Governance, Matt Albury. It comprises of government officials from the Ministries of Health, Finance, Tourism, Education, the Office of the Prime Minister, stakeholders, and civil society members, as well as port and union representatives.
Certainly, we ought to be prudent about our expenditure, ensure that we engage in those things that are going to bring us long-term benefit, whether it is in construction, whether it is in ensuring that we have the medicines and the food and the other necessary items that we need in order to ensure that we can sustain ourselves for the medium to long term. Again, we're doing what we can from our side in terms of providing incentives and concessions. We are devising an economic plan, as the Prime Minister has instructed us, to provide support to the economy in the event that there is a sharp downturn, which we hope will not come. But we will be prepared to do what we can with the resources that we have to be able to help cushion any significant loss in the economy.
Now, that was the Minister of Finance and the Deputy Prime Minister, the Honorable K. Peter Turnquest, on the economic impact on COVID-19's effect on the Bahamas. While the national flag carrier is also continuing to monitor and respond to COVID-19, Bahamas Air's daily routine involves all aircraft being thoroughly cleaned and sanitized in accordance with global travel industry best practices, applying disinfectants that is effective against the coronavirus across aircraft interiors, including tray, tables, seat covers, armrests, and seat belts. Now, additionally, flight crew have been appraised with updated travel industry practices in an effort to handle potentially sick passengers. Now, as Bahamas Air maintains its regular flight schedule, the airline has not received any information about any international travel advisory at any of their scheduled destinations. Bahamas Air will also waive change fees across all fare types to all destinations on its schedule through May 31st. Now, in accordance with the airline's fare rules policy, new travel will have to take place within a year of the original ticket issue date. With a second Caribbean island being impacted by COVID-19, local health officials were pleased on high alert due to a case of concern. Here's Cleopatra Murphy.
Minister of Health, the Honorable Dr. Dwayne Sands, has confirmed that health officials tested an American man for the novel coronavirus or COVID-19 on Tuesday after he displayed respiratory symptoms. Sands says he did not have the epidemiological history, but health officials moved to act in the public interest.
He would have gone through the algorithm to look for the other causes of respiratory infection, including respiratory syncytial virus, influenza A, influenza B. All of those tests were negative. Out of an abundance of caution, the technical team, including our infectious disease experts, our chief medical officer, our medical chief of staff, decided it was appropriate to test this person, and it turned out to be negative.
The Minister of Health was addressing members of the Bahamas Christian Council and other members of the Christian community at the Melia All-Inclusive Resort Wednesday morning, where he assured that the Bahamas remains free of the virus. The novel coronavirus has now been declared a pandemic, with more than 115,000 people across the globe diagnosed, having claimed more than 4,200 lives. Sands says some people are more susceptible than others to the illness.
It is more of a threat to older people. As I would have suggested, if you're less than 40 or less than 30, even if infected with coronavirus, the data from around the world suggests that even if you're infected, the chance of death is between 1 in 250 and 1 in 500.
He says 80% of people who acquire the virus will not know and will not require hospitalization.
A small percentage, maybe 15%, require hospitalization. 5% of the total would tend to be critical. At this point around the world, there are less than 6,000 people with serious illness or critical illness.
SAN says local health officials are taking the outbreak seriously, despite the Bahamas not having any confirmed cases. Health officials have now set up a 24-hour hotline for the public to call if they feel sick. The numbers are 376-9350, 376-9387, 376-9357, and 376-9025.
We would encourage nobody to treat themselves. Talk to your doctor. Call the hotline, and we can talk you through it.
Cleopatra Murphy, ZNS Network News.